intestine and crura. Our residents all get formal certification in FLS by midway through their PGY2 year. And typically by the end of our 4th year, most of our residents, except for the last year where there was a little bit of a hiccup because of COVID, have their FES training done. I should mention that our dedicated space also carries the Symbionix endoscopic simulator trainer that is used formally for FES. We have a standardized robotic training and certification. So by the end of your residency, if you want to have a formal certificate, that comes from us. One of our faculty, Ankit Patel, has literally written the book for SAGES on robotic surgery. And I would dare say that we're on the national cutting innovative side of robotic surgery. As far as simulation goes, built into the curriculum are cadaveric training maneuvers as well as laparoscopic peer coaching. These are all curriculum that are considered mandatory for categorical residents, get tested, they get recorded, and they're used as part of feedback for trainees in the long run to improve their technical skills. And with that, I didn't want to belabor it too long. I'm going to allow Mary Ann to get us into the breakout rooms, just a quick understanding of how this will work. We have several of our senior and junior residents broken into 2 rooms for you to be able to ask questions. Again, none of that's going to be recorded. And our faculty are all going to be placed into a separate breakout room for you to be able to ask questions that you'd want to ask of any of us. That will include faculty who didn't give introductions, but are all really important members of the program. So let's get going. One other thing I was told I should mention is that it's going to take a few minutes to move people in and out of the breakout rooms. So bear with us. That should probably be no more than about 3 minutes to move folks back and forth between the rooms. All right, Mary Ann, you want to take over?
Okay, I'm going to open all the rooms, and after approximately 7 minutes, I'll send a broadcast message that I will move the faculty and the residents to different rooms. Okay, Here we go.
It's like getting picked last for the basketball team.
Hi.
Hello.
What year are each of you?
4th year.
4th year.
I'm on faculty.
Well, how do you do? I'm Margaret Nicholson. I graduated from University College Dublin, and then I went to work for Intuitive Surgical and then for Verb Surgical. And I'm interested, my love is surgery, but I also wonder about if you have any device development, anyone interested in device development?
So we do. It kind of depends. So it's specialty specific. I'm a vascular surgeon, so I'm aware of what we have going on in our particular specialty. In particular, Luke Brewster, one of our basic scientists. He's a surgeon, but also a basic scientist and translational scientist. He does a lot of modeling for muscle strength and rehab in patients, particularly related to peripheral artery disease, as well as major amputations and rehab potential or functioning thereafter. So he has been involved in a lot of device-specific trials, whether they be within animal models or human models, with his affiliations with Georgia Tech, as well as, I'm blanking on the name here, the Medical College in Augusta. Medical College of Georgia, right? MCG, yeah. So there are those opportunities. There are more than just in vascular surgery, but those are the ones I'm aware of because I'm a part of that group.
Question, Jacob from Temple. What kind of exposure do the residents get to being able to apply for their own grants, and what kind of help do they get from faculty to do that? Like, can they start doing that right away? Is it normally in their like dedicated time off? What's kind of like your experience with that?
So in terms of the residents who do take time off to have a research year or two or wherever their length of time will be, many of them do either apply for internal grants, so like a not a KL2 but a T32 at their level of training. So that could either fund just their research in general, or like an Master's of Science in Clinical Research, or a degree level program. So that is available. Those things have to be applied for before the year of, obviously, because you want to secure that funding before you do that time. And there's certainly assistance for that. You have to choose, whichever mentor, or at least whichever lab that you would like to go into. And usually within those labs, because Emory has just a strong history of residents going out into research, not all of them do, but the ones who do, that they're usually pretty productive. So there's a good infrastructure for that.
And I know the sessions felt extraordinarily short, probably, but I want to allow out some closing remarks. I wanted actually Dr. Delman to just comment to the group a wrap up from our last question, which was regarding leadership opportunities at Emory for trainees, and then we'll close out the evening.
Over the course of my decade as program director, one of the things that's been really nice is not only did we develop a very strong relationship with GME leadership in the institution, but also the healthcare entities leadership, so Grady and Emory Healthcare as the two primary, and CHOA to a slightly lesser extent. But so not only have we had the internal leadership opportunities, as Dr. Srinivasan was mentioning, so chairs of the committees that are within the residency program. The department also asks for resident representation on search committees that are appropriate. And the institutions and GME have now also embraced having trainees involved with leadership roles across the system. And we have several residents who have those leadership opportunities. Furthermore, we've actually worked very hard to, we have several residents who've been leaders in national roles as well. So those opportunities are supported, they're advocated for by our own faculty, and many of our faculty sit in national roles that help with that. And so I think we've capitalized on that for many of our trainees. I don't know if you want to expand more on that or not, Jonathan, but that's kind of pretty brief.
Yeah, I think that sums it up really nicely. Dr. Shaheen, of course, who's our Vice Chair of Education, is intimately involved with SCORE, and we have had several residents who've been involved with SCORE on a national level as well. So I know this was short. I hope that it covered a lot of your questions, or at least spurred enough questions that you feel like you want to come and be at Emory. I would welcome everyone to please feel free to reach out to me directly or Marianne Garcia, our program coordinator, with specific questions and some feedback about how the session ran. And we do have another session that we're running in a couple of weeks. We'll obviously make some modifications, but if there were questions that you specifically had that couldn't be addressed in our group chats today, please do feel free to reach out to me directly. Because I'd be happy to answer each of your individual questions via email. I have about 600 emails a day, but I'll unbury it and answer that at some point in time. Dr. Sweeney, did you have anything that you wanted to add?
I just want to thank everybody for taking the time to be with us tonight. Really appreciate it. One of the questions that was asked I didn't get a chance to answer is, if there was one thing, what would I change about the program? I jokingly said to everybody, nothing. But the reality is, the one thing that we have to be mindful. Emory Healthcare is growing so quickly and becoming so large that we have to be mindful that with this growth that we're continuing to focus on providing the optimal trainee experience. And so that's the one thing that I look at and I'm mindful of. But otherwise, we have I often say we suffer from an embarrassment of riches, and because we're immersed at Emory every day in what we have around us, we oftentimes fail to recognize what we have and how special it is. And it's moments like this when we get a chance to interact with you all that we it allows us to back up and to really step back and really understand how special a place this is. So thanks for participating. Thanks for letting me participate, Dr. Srinivasan, and I'll pause for anyone else.
And I have to very much point out there are a few places where you're going to find a chair of the magnitude of Dr. Sweeney, who at every interview session, he takes time, I mean, in non-COVID eras again, but he's done this virtually now, to meet with the trainees and talk to them like they're human beings. Again, I think just highlighting some of the fabulous things about this place. Also, you've hopefully realized based off of the resident breakout rooms, we had residents, they're all on their clinical campuses. They're calling in from Grady. They're calling in from their research time. They've helped design all of this stuff. Jessica Lube particularly has been really instrumental in helping us design things, because I'm old and I don't understand social media that well. Thank God we have bright people like Olivia Keene and a lot of our residents who they love this program, and the stuff that we design is an expression of their love of the program. So I really want to thank all of the residents for chiming in. Michael Turgeon, who's one of our research residents in the oncology lab, did put in the plug. Don't forget to follow us on Twitter at Emory Surgery and Instagram at Emory Gen Surge. One of our residents actually put together a video that's now our pinned tweet. That's a short teaser video about information about the institution. I would encourage everyone to please check that out. Thanks very much, everyone.